deep gratitude for the invitation to take part of 5th edition of World Congress on Endocrinology, Diabetes and Metabolism, which theme is treating research, innovation and insight into endocrinology, diabetes, metabolism. My name is Rano Alieva. I am from Uzbekistan. Presented the departure of coronary heart disease and atherosclerosis, Republican Specialized Center of Cardiology. The name of our topics is E67OG PCSK9 polymorphism in the heterozygous familial hypercholesterolemia and coronary artery disease with diabetes is the bridge to the personal therapy within reach. Mortality from coronary vascular disease still remain high in the countries with developing economics, such as Uzbekistan. And in 2023, it was 61% mortality by main causes in the period from January to December, and show us that mortality from disease of coronary artery disease and coronary vascular disease, heart disease of the circulation system was still is high. An analysis of statistical indication of the diabetes mellitus in the CIS member states in 2019 in population showed that the mortality rate due to diabetes mellitus in 2019 was 62% in Uzbekistan, and this is the third highest place in the CIS countries. If we see ESC guidelines of diabetes and prediabetes and cardiovascular disease with the ERSD showed the hazard ratio for vascular outcomes in people with versus and without diabetes at baseline showed the still higher with coronary heart disease and coronary death. Genetic studies have played a crucial role in the discovery and identification of the disease. From Carl Müller first report in 1938 of hereditary high blood cholesterol and symptomatic disease to the widespread use of monoclonal antibodies in the treatment of hypercholesterolemia. Different genetics architectures, mono, oligo, and polygenics, are defined by taking into account the frequency of the alleles, specific DNA sequence involved, and the impact of the DNA variants they carry on the biological function of the encoded proteins. Population of Uzbekistan in the end of 2023 amount 36.6 million people. Average frequency at the heterozygous familial hypercholesterolemia 1 by 2,000, and if we take the average incidence of FH as this 1 to 2,000, when there are 175,000 such patients in our country. In our registry, estimated number for FH in the cardiology center, about 3,000 patients are observed, which is only 1.7%. That's why questions of FH is very, very necessary. Domain structure of the, as already mentioned, there are genes associated with suppressing proteins function and those associated with increased protein function. There are reviewing the E670G PCSK9. It is unfair that the gain of function PCSK9 mutation, which initially provided the key to discovery of the role of PCSK9 and ushered in a new era in the treatment of hypercholesterolemia, included heterozygous FH, has subsequently given way to loss-of-function mutation. Despite their rare nature, occurrence is about 1 in 5 to 2 and 5% in the population, and is threefold less common in coronary artery disease or ischemic heart disease. The aim of our study was to assess the distribution of PCSK9 E670G genetics polymorphism and PCSK9 levels in patients with coronary artery disease and heterozygous familial hypercholesterolemia based on the presence of the type 2 diabetes mellitus. The study included 2,001 patients with chronic coronary artery disease, including those with heterozygous familial hypercholesterolemia. Number of group first number patients was 57, and without FH, number 144, group 2. Dutch lipid clinic was used the diagnosis of heterozygous FH. The PCSK9 level E670G RS 155151 polymorphism was genetically typed using the PCR RFLP procedure. In both the patients and control groups, the genotype frequently matched the Hardy-Weinberg equilibrium distribution. Since the G alleles is the gain of function mutation, but it's rare, we studied the clinical parameters on patients with depending on the carriage of damaging G alleles, like in the table. In patients with heterozygous FH, diabetes mellitus was significantly more common in carriers of the AG plus GG genotypes of myocardial infarction and revascularization. In non-heterozygous FH patients, diabetes mellitus was also more common among G allele carriers. There were twice more G alleles in group 1 than in group 2, and twice more than in the healthy control group. Relationship between carriage of the G alleles E670G polymorphism of the PCSK9 gene and the severity of the clinical course of type 2 diabetes in patients group 1, G carriage was accompanied by a high incidence of myocardial infarction, stroke, and a history of coronary artery bypass grafting, indicating multifocal atherosclerosis. Diabetes mellitus was present in 18 patients with coronary chronic heart disease with heterozygous FH group 1, which did not exceed their number in group 2. However, in group 1, the majority of them turned out to be carried of the G alleles. But carriers of HG plus GG genotypes group 1 had a high chance to having a history of 2 T2DM, myocardial infarction and revascularization than AA carriers. Type 2 diabetes mellitus was also more common among G alleles carriers in patients with non-heterozygous hypercholesterolemia. In conclusion, type 2 diabetes mellitus in patients with coronary artery disease, both with the heterozygous familial hypercholesterolemia and non-heterozygous familial hypercholesterolemia in Uzbek population, was significantly more often associated with the presence of the gain-of-function G allele of the PCSK9 E670G genetics polymorphism. In the end, I want to say thank you, and this is our name of our Republic Specialized Scientific and Practical Medical Center for Cardiology of Ministry Health of Republic of Uzbekistan. Thank you so much.